So the list kind of continues with these patients, depending on the breed really. So they can have varying degrees of different problems. We'll all have seen our breed-based issues, so I'll just go through a few of them. So due to the shape of the skull, we do get a lot of ocular problems in our brachycephalic breeds. The shape affects facial nerve function. It reduces the blinking reflex and palpebral reflexes, predisposing patients to corneal drying and ulceration. The shallow orbit of these dogs tends to make them more prone to any globe protopsis, so care should be taken when we're handling them or putting excessive pressure on the neck during restraint. Hairs from the skin fold can also rub on the eye, especially if they're a breed prone to lots of facial skin folds, and this can cause long-term damage from rubbing on the eye. It can cause scarring, pigmentation, and corneal ulceration again. Distichiae and atopic are other eyelid abnormalities, so we're going to have an abnormal growth or positioning of the eyelashes. Again, this can be growing in different directions into the eye. Often they can be growing in the corner of the eye and they are rotated inwards, and they will create scarring and ulceration also. Another commonly associated eye problem is our dry eye for these patients. They also, because of the position of the eyes at slightly outside of the normal skull shape, they are quite prone to injury of the eye by running into things, because everything is just that little bit further out and less protected. Our neurological abnormalities then, mostly pugs and French bulldogs in the small breeds will have vertebral and spinal malformations. Often these are in the form of hemivertebrae, and this tends to be due to an incomplete formation of the vertebral body. So we can either get an abnormal dorsal curvature of the spine, so our kyphosis, or we can have a incomplete caudal articular processes of each vertebrae, which means that they generally just don't have the articular processes properly assigned to the adjacent vertebrae. Another spinal abnormality quite common in the pugs and French bulldogs is our spinal arachnoid diverticuli. This is characterised by a focal fluid accumulation, usually on top of the spinal cord. It can look like a little fluid-filled cyst on the spinal cord if we look at an MRI. And these tend to become progressively larger over time, putting more compression on the spinal cord, and these do require surgery. Our brachycephalics also generally have an impaired cerebral spinal fluid circulation, so they are predisposed to things like hydrocephalus, particularly in our chihuahuas, and Chiari-like malformation associated with pain and syringomyelia in our cavaliers. They also tend to be prone to atopic skin disease. Excessive folds around the face form a moisture trap and tend to rub. This can cause inflammation. It harbours bacteria and yeast and adds to, increases the risk of skin infections and bad odours in these patients. From a cardiology point of view, our English bulldogs, boxers and French bulldogs do have an increased risk of congenital cardiac abnormalities. They also can have acquired myocardial damage, which may be secondary to chronic hypoxia in particularly BOAS affected patients. This can cause hypoxia, pulmonary vasoconstriction, and long-term can lead to pulmonary hypertension and right-sided heart failure. These patients also tend to have a high resting vagal tone, so this with an anaesthesia makes them prone to bradycardia, sinus arrest and syncope, and sometimes accompanied by second-degree atrioventricular blocks. And then our final bit is our orthopedics. So again, our French bulldogs in particular are quite prone to humeral condylar fractures, especially when they're young, and patellar luxations. It's not really clear, and there's no real evidence as to why it's so prevalent in these breeds, but anecdotally it's what you tend to start seeing very commonly with them. And then with dental disease, because generally the lower jaw juts out further than the top jaw, we tend to get teeth kind of growing in abnormal dentition and coming through at any part in the face. It's a bit all over the place.